So, welcome back. My name is Cecilia Edström, and I will lead this session on why we need to involve patients in the decision-making process. Patient safety is, as we all know, not new at all. It's been a priority since Hippocrates invented medicine as a separate discipline some 400 years before Christ. And for those of you who are healthcare workers, you've all taken the oath. He advised physicians to help, or at least to do no harm. So I believe it's fair to say that it's always been part of medical practice. But how far have we actually come on this journey? I thought we'd take a closer look at Sweden, because every year, approximately 100,000 patients suffer from adverse events in healthcare. How much is that? It's 1 in every 10 cases of patients receiving care, or 1% of the total population, who actually got worse after being admitted to care. Even more alarming is the fact that some 1,200 people die every year from these injuries. If you compare that to how many people die on the roads, it's about 200 or 300, and that is considered a high number. And there you even know you take calculated risk when you drive on the roads. These injuries also result in extended hospital stays, of course, for about 50,000 patients. And when I looked at this a couple of years ago, the number of patients injured, or at least in suffering from healthcare-associated infections, the treatments of those patients was enough to occupy the entire Karolinska University Hospital for a whole year. Staggering. And in addition to the suffering, these extended hospital care days actually cost a lot of money. It costs about 8 billion Swedish or 800 million euro every year. And that's money that could be much better spent. And of course, then the other healthcare costs are not included. The cost for sick leave, loss of tax money, etc., etc. I've spent almost 10 years with a Swedish company called Bactiguard, where the mission is keeping people safe from infections by providing effective solutions for prevention. Is this really necessary, you wonder? Yes, it is. Because if we look at the global situation, 1 in every 10 patients treated in a care facility actually receives an infection. And sepsis is already the leading cause of death. 1 in every 5 people actually die from sepsis. If we combine that with antimicrobial resistance, the picture gets even more grim. By 2050, it's estimated that 10 million people will die from infections that cannot be treated. That's more than kills that's more than the number of people who die from cancer, all forms of cancer every year today. I think you all agree by now that preventive action and early detection, diagnostics, is urgently needed to keep patients safe. So what is patient safety? These are some of the most frequent words related to patient safety. Risk, help, care, treatment, and so on. But it's clear that at the center of all of this is the patient. This is I and a group of friends, very close friends, who spent the weekend hiking up in the mountains, spending valuable time together, eating good food, socializing, being in a social context. Would you agree that these are also aspects of future health care that should be taken into account? How do we spend our time pre-surgery, post-surgery, and to keep a healthy lifestyle? So what do you think is now the time to really shift focus from eliminating avoidable harm to real patient safety by involving the patient? And to refer to what Neelam Dhingra said, joining the WHO in fulfilling its vision of a world in which no one is harmed in healthcare and every patient receives safe and effective care every time and everywhere. Please join me in welcoming the panelists who will share their views of why we need to involve patients in the decision-making process to improve patient safety. Lise-lott Eriksson, please join us. You're chairing the Swedish Blood Cancer Association as well as the European Patient Organization for Myeloma. Welcome. Please take a seat. Thank you. Please also welcome Radoslav Herda, who's president of the Slovakian patient organization Slovensky Patient. Brian Lee is a director on the patient advocacy team at Bristol Squibb, based in Princeton, New Jersey. Brian is responsible for leading strategic engagement with advocacy groups across the entire product development and commercialization process. Mostly welcome. Last but not least, Andrea Rappagliosi. Andrea is the Senior Vice President of Public Affairs for EMEA, Canada and Latin America at Edwards Lifesciences, and is also a member of the Regional Executive Leadership Team based in Switzerland. He's leading the government affairs, market access, communication, and perhaps most importantly, patients advocacy team and engagement for the company. Andrea also recently joined the board of the European Patient Safety Organization, and I think that's very close to your heart. So welcome everyone. I'm so glad that you could join us for this panel. I'll kick off with a question for Lise-lott. What does patient safety mean to you? We've heard different views. I've shared a few. But what does it mean to you?
Well, I would like to actually open up for... Today, we are in an era where I come from a cancer organization, blood cancer. That's what we are working for. And there are so many innovations. All the time, all days, there are just new innovations coming. And we have reached a point where before you died, but today you can live with a lot of diagnosis as a chronic disease. However, the most important thing is that the right patient get the right treatment at the right time. And I would actually open up for that is what it is all about, actually, patient safety. To secure that the right patient get the right treatment at the right time. And that is a lot of things. It all starts with you need to get an early diagnosis, the right diagnosis, and then you can see for the moment, it's all about targeted treatments. And that's what you can do if you get the right treatment, or if you get the right diagnosis early on. But it is also to have patient involvement in all these kind of HTA processes, and to start with actually the research. We want to be involved in the research question, because if you start the research question that what is patient involvement, I think you would do everything, it would be a lot better.
Thank you. Radoslav, you also represent a patient organization. What's your view of patient safety?
My view is to collaborate with patients, and we are thinking about how we can inform them. Firstly, how can we motivate it to be or to take a part in the processes, because there is capacity to bring some kind of feedback to these processes from the patients. And what is next important to talk about situation? What is trigger? How can they behave in a specific situation? They have to recognize them, and they have to know what to do in these situations. And after that, if all this process is done, is finished, we have to measure it, because what we don't measure, it doesn't exist. And we are thinking about especially motivation, how we could deliver the right motives or values to patients' life, or how we can motivate them to be active in these processes. It's our role. And we are focusing on two relatively major topics. One is safety of drugs. We are cooperating with the Ministry of Health, and we are creating some patient guidelines. And the second one is implementing of ERAS protocols in hospitals, because the big role of a patient in this process, because active, good prepared patient is very important for the results of surgery in hospitals. And this is, for our organization, is very important to play this role in the hospitals.
Do these guidelines and procedures also involve the pre-operative period before you have an intervention and afterwards?
Yes, this is our aim to prepare something like guidance or protocols for patients. We are cooperating with the big or number one state hospital in Slovakia, and we prepare with them the guidelines before surgery, because it's about 4 weeks preparation to operation. It includes eating, exercises, and stop smoking, stop receiving alcohol, and so on. And the patients must be informed and accompany or guide with some protocols.
Thank you. Andrea, I know you feel very strongly about this topic as well, involving the patient through all processes. What's your view? What's most important to you?
I think, Cecilia, what we heard earlier this morning from the lady Dr. Dingra from WHO, the numbers are impressive. I was reading recently an article on the New England Journal of Medicine. 2,400,000 people go in Europe in eye surgery every year, average. 1 out of 4 develop serious complication. 1 out of 4, you enter in an hospital, you count 1, 2, 3, 4. 1, 2, 3, 4. It's huge. Yeah. It's too much. It's something to which we have to react. We have to do something. It's not because it's nice to have a better, safer patient. It's critical because a patient already is suffering for the disease. They bring he or she in the hospital, and then also has 25% of risk or serious complication, unacceptable. And that's, I think, all what should motivate collectively and find pathways within, you were quoting before, from the diagnostic, and accompany the patient through the entire patient path, diagnosis, monitoring, referral, hospital, surgery, out, rehabilitation, whatever. But also in the normal, I would say, when you are still not a patient in a certain way, no? When you are just a simple citizen and maybe you have a doubt, no? You feel a kind of a symptom, but you are not sure. There you should have a great conversation. You need to have an element of continuous dialogue with your physician, have good awareness of the potential disease, and when you have the diagnosis with the disease, knowing exactly all the options. This dialogue, this early dialogue, physician or healthcare system, citizen, patients, is the best way to create that trust that can accompany the patient through the entire process. And a safer patient, for sure, will deliver better outcomes, which is the ultimate goal that we all want. Being safer, healthier, and be back to society, to the family, to our beloved in a great shape.
You and I talked about this a little earlier because there's so many experts out here. We all Google. Whenever we feel a symptom, we go on the internet and think this might be this, or it might be that, or it may be a trillion different diagnoses. How do we deal with that, and how do we get good information, reliable information to patients, both of what they may be suffering from, but also what potential treatments there are, innovative new treatments, and having access to real care? Anyone who, you're nodding, Lise-lott, would you like to respond to that one?
Yeah, I think it's very important that you, when you're talking about patient involvement and patient safety, there are two perspectives. You have the individual perspective. There we can have patient experts. But then we have also the more organizational perspective. And there you have, the patient organizations are very important to empower the patient to get for patient rights and to get what you were mentioning, to get the right information, to be involved in all the protocol and all things at the hospitals and whatever. But I think you need to be aware of that there are two perspectives, and it has to be involvement both in the individual perspective, but also in the more systematical perspective, where we can talk about having patient experts and patient advocates involved in all the processes, where it comes from all the start of the research to all these kind of issues where we talk about how patients get access to novel treatments, because we really need to be aware of that. A lot of patients in Europe, they don't get access to novel treatments at all. And that is a really issue about security, because if you don't get access to novel treatments, then your way of getting complications from treatment are a lot higher, and side effects and whatever.
Let's move on to that. Innovation, Brian. I know you spend a lot of time looking at innovation and how patient input can go into drug development. Would you like to share some of your experience there with us?
Sure. Thank you. So from a manufacturer or industry perspective, I think we're at a crucial time in really the evolution of patient knowledge. Patients, patient advocacy organizations are becoming much more influential, much more experienced, much more knowledgeable in working in the healthcare system in totality, with hospitals, with patient organizations, individual patients, and with sponsors and industry. Within the industry side, we're also beginning to work with patients a lot more. I think traditionally we would work with patients and patient organizations probably a couple years before launch of a product. Now we're moving even earlier, trying to incorporate patient input into at least our global phase 3 trials, getting input into inclusion-exclusion criteria, getting input into quality of life indicators, patient-reported outcomes, getting their thoughts on benefit risk, which obviously deals with patient safety as well as benefits of a potential medicine. But what we're doing, and what I'm doing more specifically, is trying to move even earlier than that, getting input from patients and patient experts into phase 2, phase 1 studies, even before phase 1. And that's, I think, where it gets complicated. Before phase 1, you don't have any information on safety and efficacy. If you recall, phase 1 is to look at patient safety. Is this potential medicine safe for patients? You look at the potential characteristics of a drug and really try to move forward. How can we work with patients that early when we don't have safety and efficacy data, but how can we get their input on characteristics of multiple assets and work with patients and patient experts really throughout the entire process? I think it's absolutely critical. It's an area that we're starting to do a lot more work in, and I encourage every company, industry sponsors to really start looking at this. I think we're getting much more progress, and working with patients and patient organizations is really progressing very nicely in the recent future.
So what are the key challenges there in early drug development where you don't have the real risk safety, risk-benefit safety analysis? Are they ethical, or what are they? Are there any key takeaways that we could bring with us?
Yeah, it's a great question because of all the challenges. I think the major challenges are no safety efficacy data when they're that early. But I think people also don't realize that the failure rate of medicines from phase 1 to phase 4 are very high. In oncology, it's 95 to 97% chance of failure rate. So we're talking about 3 to 5% chance of success. So it doesn't mean we get input from the patients on every single asset that we're looking at, but maybe to get input from the patients on the broader patient journey, really larger topics like benefit risk profiles, tolerability, really what are the key unmet needs in that disease space. And that way we can get their input to help inform maybe 5 or 10 assets that will move forward, hopefully one that ultimately becomes approved.
Lise-lott, you were waving.
Yeah. Yeah. I totally agree that it is absolutely critical to have patient involvement in that phase that you're talking about. And I think that's where you formed the research question, and also where you start to form the trial with comparative arms and so on. And that's where I think it could make a difference to have the patient involvement, because that's where you actually start a safety discussion. How do you form the trial, actually, to be patient-centric and to be patient involved? And I think that's where you need to have the patient involvement.
Radoslav, any view on this from you?
I'm thinking about the situation, because we can plan and we can see the situation where the patient has a very important role, and for example in the development of a drug or in the clinical trials, but there are a lot of situations where the patient is very important, because if he or she could say about his or her needs, about psychological settings, about moods, and then so on. This is very important for aiming or targeting of a treatment, or and this is, for me, is very important to hear the patient's needs in these processes and to lead all these processes according with patient's needs. This is very important for me.
Andrea, what role can the European Patient Safety Organization play throughout the process, from research, development, diagnosis, treatment, information, etc.? Where do you think it's mostly important to focus right here, right now?
Very difficult to pick one of the phases that were discussed, because at the end of the day what you hear is a continuum.
Yeah.
You start from the early phase of the research, really when you start to think, when you move from the lab to the first in human, just to translate in technical terms, and then you want to accompany that. The role of patient organization is the role of being first the powerhouse that provide the patient perspective. They can have the full spectrum of the different steps. They can be also a bit the guardian of a certain level of governance, because let's be honest, very often, and I came from the private sector, we should avoid the patient input in the development phase became, a nice to have, tick the box. Okay, I made my patient panels, I heard from them, but I continued that. How you really integrate, you measure with concrete, tangible milestone that this is happening. There are options that also methodological are used, like patient preference studies, patient elicitation. There are efforts of the European Commission in putting money in that. So also some methodological approach needs to be more sophisticated in order to be more accepted, to move from the anecdotal to a more objective data that can be considered through the development phase. And then I remain to what I was saying at the beginning, fundamental remain the patient-physician relationship, and how you can move that to a really co-decision process from the diagnostic to the intervention to the follow-up. I think that innovation is not only about technologies, but it's also innovation about processes. So how you manage that. You can have an incredible technology with a very cheap process, you don't move a lot. You can have a fantastic innovative process with an obsolete technologies, you don't fix the problem. So I think that these two dimensions should be pushed in parallel and observe as they interact. My final comment, this year, and I think there is always the light at the end of the tunnel, so just to be in positive things, the European Society of Cardiologists, together with the European Cardiosurgeon Society, they renew their guidelines every 2 years, and this year, for the first time, a line in which for heart valve disease, they ask the co-decision, they indicate the co-decision with patient on their preferred therapy or solution, or medical solution. So you see, obviously is a line, in a book of guidelines, but there was never been. There is. So there are some hook in which patient organization, I'm back to your question, can really enter in, work and say, okay, how we can make this happen? How we can make this as a standard operating procedure? That, I think, is the way of moving on.
I mean, patient outcomes are clearly important, that you come out of whatever intervention you've had in a better shape than when you entered. Measurement, looking at are there adverse events or what is the outcome of a particular treatment. But it may also be controversial to share. For example, if I was a man and wanted to have prostate cancer or needed to have prostate cancer surgery, I would probably opt to go to the Martini clinic because they are the experts and not to my local hospital back home. Could this lead to competition for resources, which would be in a way detrimental? Or do you think it's good always to share data on outcomes and what effect different treatments at different sites would be?
I think in an informed society you cannot avoid that. I mean, if I'm a patient I want to know what the best treatment or the best surgeon or the best team is. You cannot avoid, you cannot hide and say, well, you know, it's based on where you live, a postcode lottery, you are assigned to this hospital and not to the other one. And today, you know, we live in this, I was talking before, social media, etc. So you got lots of information everywhere. Some good, some medium, some, you know, rubbish, but still you got all this ensemble. And I think also from an ethical point of view, a bit of, you know, best practice, some benchmarking, why not? I mean, it's the way as we progress in whatever we do. Right now, is how you can elevate, that should help to elevate every hospital or every healthcare community to the best. It's not just to seclude and say these are number one and you remain, no? But how you can, from that, build an healthy process of, you know, increasing outcomes.
Brian, how do you collaborate with hospitals and actually training the physicians and the healthcare workers in order to make best use of the new practices?
Our experience with hospitals in Banska Bystrica, it's town in the middle Slovakia, is that they want to collaborate with us. They got some ideas that if they create it once, it will be finished. And they, firstly, I think they don't want to cultivate these processes. I strongly agree with that process is very important, because if we improve processes at the end, we could have better results. But it's, I think right now they asked our organization to give them some trainings for doctors. They are very open to improve their skills, communication with patients, and they are oriented on satisfaction of the patients, because this is for bench ranking is very important, and they have to stay on the first position in this bench ranking system in Slovakia. And I think we will reach a new cooperation, and after that, if we really honestly, sincerely cultivate this process, I think we could reach better results.
Okay. Brian, how do you cooperate with the healthcare system and with patients in improving this?
I think it's a great question. I think when we look at the healthcare system, there are so many stakeholders involved, including patient organization, hospital, payers, regulators. We are really looking to work with everyone individually and then bring all those insights collectively together to have broader processes and understanding. I think it's very complex, because we talk about differences in local implementation at a city level, then you have regional, national, continental, regional, and global. Just within research, when we talk about clinical trials, we talk about protocols that are different within each clinical site, and that can be within a city. And then we have different protocols within the countries, and then we have global protocols. Yeah. So how do we harmonize those? And I think the first step is getting patient input, not just at the local level, national level, regional, and then global level, and then bringing those insights together. Obviously very, very complex, but I think we're at this point where we're starting to do it as an industry, and we're starting to see some of those benefits. And I think the great thing is that we can only move forward from here.
Let's open up and see if there are any questions from the audience on what you've heard. I think there might be some mobile microphones. Yes, please, over there. Do we have a microphone? It's over here in the middle.
Hi, I'm Helena at Roche, and I was thinking, I think we all agree that patient voices are important in everything we do, and the earlier the better, and also long term. But I was thinking about something that Brian said, and that is that healthcare is so many stakeholders. And one stakeholder is the payers, and of course the payers are focused on money. So I was thinking about maybe something like a reflection from all of you. How do we also get the payers and HTA unit and the other stakeholders that have other measurements on board? Just a reflection maybe for...
Yes, sure, please.
I think if you allow in a very provocative manner to answer to you, I would say the payers or HTA doers should be the champion of patient safety, because they pay for the outcome. They are the first one. So their value for money is not how much it costs one pill or one device. It's what they are paying is the outcome. Because a patient that leaves the hospital with that number of complications, or a cancer badly treated, etc., 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 it costs more. So I think that I'm expecting really that they stand up to support patient safety and better outcomes. And not looking at the single cost, you see what I mean, maybe this costs 1 cent less. They have to think what the outcomes, because payers average, especially in our region, they manage public money, taxpayer money. So their goal is not profitability, their goal is better outcomes for the society.
Okay. Yes, Brian.
Can I add? I think it's a great question and an excellent topic that you bring up. When we talk about payers, outside the U.S., within U.S. and Europe, oftentimes they're looking at maybe 2 medicines that have similar outcomes sometimes, but sometimes there are different patient-important or patient-relevant outcomes that are not measured. As you know, when we do clinical research, we look at oftentimes clinical markers that are more easy to quantify, easy to measure, but there are also other things important to patients, like quality of life, things that are harder to measure. And so what do we do about those? We really encourage patients and patient organizations to interact with regulators early on to tell them, this is important. It might not be the primary outcome that's measured, might not be the clinical surrogate marker that's measured, but it affects my life. This medicine helps me feel better, and we should have a choice. And so we really encourage patients and patient organizations to engage with those regulators early, let them know this is important, because at the end of the day, we should be working for the patient. And that's what we're trying to do from industry side as well.
Lise-lott.
Yeah, I think it's a great question, actually, and because there are so many stakeholders, and the payer, they are very important, but I think that, Andrea, you brought up a very important thing, that we used to have this patient involvement is just a tick-the-box exercise, and that's what we really need to come. We need to see the patient as an expert, and the value the patient brings. Because if we don't talk about the patient value of the innovation, when it comes to where we are today, there are so many innovations, and to have a sustainable environment, we really need to bring the things to the market that have patient value. And if you don't see the resource in the patient as an expert, because the patient is the one that, by the end of the day, is the one that are going to have it.
Yeah, so focus on the health, economic, and the patient-centric values rather than just looking at the cost of treatment.
Yes.
Radoslav.
For me, it's a comfort, ethical question, because, for example, in ERAS protocols, if we improve all these processes, we could cut 30% of invested money to the healthcare. We could save. And for example, the investment to implementation of ERAS protocols 4 times we receive 4 times more money when we invested to these processes, and at the end there are less complication, less hospitalization, readmission, less pain, and so on. And I think it's going hand in hand this specific area of ERAS protocols.
Thank you. We're running out of time, but I want to finish with one question, which is related to the elephant in the room, the COVID-19 pandemic, which has put effectively all other care on hold for almost 2 years in several regions of the world. What impact has that had on patient safety? Do you want to start, Andrea?
I think what we've learned from COVID-19 is that most probably in what we are discussing today, a better informed patient will release a lot the stress of healthcare workers in terms that you can have a conversation straight to the point, to the core, to what really matters, and healthcare workers were really put under enormous stress. We read from the news, from studies, analysis, so we all know. And I think that again, is another way of innovation in processes, having patient informed, able to have effective conversation with the healthcare workers and accompany that and reduce the stress.
I think it's a great question. Unfortunately, with the COVID-19 pandemic, there were a lot of issues. We heard from many patient organizations that patients were not seeking appropriate medical care because they were scared to go to their doctor's offices. Clinical trials were paused. So a lot of, I think, issues that were unexpected. And because of those, what we have done, I think, as a society is really evolved and addressed those issues. We're seeing much better use of technology within research and clinical trials, digital clinical trials, virtual visits with healthcare providers, patient organizations that help patients track their side effects and symptoms through mobile applications. So just much better use and faster evolution of using technology to incorporate patient input and patient voice within the healthcare environment as a whole. So I think because of COVID, luckily we've sped up the use of technology to include patients within this conversation.
I would agree. Radoslav?
Slovakia was premiant in the first wave of COVID, but on the second wave of COVID we had the worst results in the world. And we are very young nation, and we are probably strictly follow the leaders, but our leaders failed in this leadership, and it brings a lot of deaths in Slovakia, and we very difficultly recognize what is good and what is not, and a lot of information are not based on medical studies, and it's a little bit chaotic in Slovakia. And but this is something like a level of our development of our nations, and it's complicated for us to go through this kind of crisis.
Yeah. Lise-lott.
Well, it has been a huge problem with late diagnosis in the cancer field. And a lot of patients all over Europe have got their diagnosis all too late, which has been a real huge problem. However, something that I think that we have learned is also the trust in innovation, the huge innovation and the power of innovation. And I think that's something that we need to have in mind in the future, the really power of innovation, of getting this vaccine. If we hadn't, we wouldn't have been here today. So actually, I think we have a future in innovation, and I think that's where we need to have the patient involvement in the new innovation coming to the future.
I think that's a great concluding remark. The power of innovation that comes from the patient, and also sharing and spreading it through communication, both to patients and to physicians. We could continue talking about this all day, but we have to clear this for the next panel. So thank you, Andrea, Brian, Radoslav, and Lise-lott for sharing your experience. A warm hand to all of you.
Thanks to you, Cecilia.